Hi, my name is Kyle and I'm here again at CSA Medical Aesthetics, to which I have the honor of getting another treatment by none other than the Dr. Contessa herself. This is going to be my second under-eye treatment. I think the first one was more than a year ago, but I'm excited because this is going to be the first time, my first follow-up treatment, to which I'm going to experience having the Colshine Collagen injectable and booster. And I think we're going to use the Bello Pro machine, so I'm very excited how that will go. Don't forget to hit that subscribe button and notification bell.
Good day, everyone. Welcome to the CSA Medical Aesthetics. I'm Dr. Contessa, your certified aesthetic physician. In today's episode, we have a follow-up. Let's all welcome back Kyle Arceo.
Hello po, hello.
Yeah. So, he had his procedure of under-eye dermal filler injection a year ago. So, it's been a year. So, right now, we can do a reassessment and see again what happened. So far, how are you, Kyle?
I'm doing very good. Sobra pong ganda ng effect ng last year na treatment. Yeah. It was very evident, and at the same time not so obvious, but at the same time obvious, which is what I was going for. So very.
Yeah, we wanted the dermal filler under eye that's gonna have this natural result and something kind of like improve the skin quality of the under eye area and also treated the volume loss. The concern with dermal filler under eye right now, because for some people, they don't want it for their under eye area because others had this experience of filler under eye that became a bulge or like a sausage-shaped elevation under the eye, especially when they smile. Because I get patients who are telling me, Doc, I don't want filler under my eyes because in the past I had this experience that it created this eye bag effect because the dermal filler that we are using is hyaluronic substance, and hyaluronic is very hydrophilic. It attracts water. So like if you have filler under eye, what's happening is a lot of water is coming in. That's why it's kind of like it looks swollen. So for some people, they had that experience na yun nga yung kala mo palagi silang may eye bag or parang manas yung under eye nila. Those were the fillers. In the past, we had this technique of injecting it above the muscle ng under eye. So whenever you smile, so the muscle is contracting, nagsishorten yung muscle, it pushes that filler above. So parang meron silang bulge. Iba naman yung some cases na they requested for, if you heard of Egyoshal or charming eyes or eye roll. That one naman, they want to create yung parang bump sa lower eyelid. So we call that Egyoshal. It's very famous in Korea because some Koreans, they want to have this, they call it eye roll eh. Hindi siya eye bag. Parang elevation lang, exactly dun sa lower eyelid, na it makes them look like charming or cute. So yun naman, we place it above the muscle so that it will bulge out. Pero there's this, cases na injected filler doon sa mismong tear trough. We call that a tear trough. So over time, the filler attracts water, nagbo-bulge siya. That's why when we inject dermal filler for under eye, and depending on the type of filler we are using, because the fillers have different rheological properties.
Yes.
Okay, medyo mabigat yon. So, these kinds of fillers should be kind of like, classified according to the areas where we can inject them. So, merong filler for nose, may filler for cheeks, may filler for chin. Hindi pare-pareho ang fillers. They are not similar. So, if you place a wrong filler in a wrong place, then problems will arise. So, if we use a filler sa under eye that is very thick or viscous, and then yung skin mo under eye naman very thin, so that will create a problem. So, we should use the right material or the right product in the right plane or right anatomical layer, and also yung injector, yung skills, the techniques of the injector. So those are important things to consider whenever you want to do procedures like this. Because I get patients asking me about, Doc, how come some cases they have this, experience with dermal filler for under eye? So we want a material that will spread evenly and become homogeneous, and it will not create yung umbok. So that was the problem kasi with fillers in the past. Then right now, the filler that we inject is specific dapat sa under eye, plus correct placement, and also the injection technique is correct. Yan. Those are important things to prevent po those complications. The good thing naman with dermal filler, it is reversible. The hyaluronic substance we inject po, you can reverse it. You can dissolve it. So, no worries for people who had that experience na nagpa-filler under eye, and then some are thinking na baka permanent na. So, if you use the hyaluronic filler, meron pong antidote, pwedeng i-reverse yan. And the good thing with the product we used with Kyle last time, it has also hyaluronic acids plus other micronutrients to restore also yung health ng skin. So your skin cells will also need micronutrients. Kaya in your experience, you didn't have that bulge, di ba?
Yes.
You didn't have that bump.
Yes.
Or yung parang mga sausage shape na umbok. You didn't have that.
No.
Yon, yung mga complications na ganun. Wala. It's
Wala.
so smooth. It was so fine. A good experience with Kyle. Yes. And anong comment? Anong feedback?
Actually po, may sinabi si Doc Roxy po nun after.
Yeah.
This was even right after or a week po na after ng procedure. Sabi niya po, lumitaw na ang eyes mo. Tapos parang sabi ko, ba't ganun po yung description lumitaw? Tapos nung chinek ko po sa mirror at saka sa mga photos po, dahil po sunken nga po yung eye bags ko, ganun din po lumilitaw yung mata. So, nung nagkaroon na po siya ng parang laman ng filler, mas lumitaw yung eyes ko. Parang, ganun pala yung ano.
Oo. Hindi yung mata may nakikita. Yung nakikita yung hollow under eye.
Opo. Totoo po.
So, it's a good thing that you had that good experience. So, again, the right product material, the right injection plane, and also the right injection technique. And also the right patient. A very good patient who is compliant also with all the post-care instructions.
Yes.
Yan. And healthy lifestyle. Now, a year is already, kind of like it's a year already.
Yes.
A year had passed. So, these kinds of treatment, we have to do some boosting, some maintenance. Yan. Kasi, your lifestyle pa rin, di ba? Like, Kyle is so busy. Yan. Baka napupuyat pa. I think minsan nagme-message ako parang 2 a.m. gising pa eh. So, sleepless nights.
Yes.
Yon. So, we still want to do a kind of like a booster or a maintenance treatment. This time, we'll be using a different product because last year we used hyaluronic substance with micronutrients. We'll also use now naman collagen itself, because our skin contains 80% collagen. And as we age, collagen gets depleted. So, si Kyle, because of the lifestyle, kind of like it's contributory to aging.
Yes.
So, yon. So, we want to do something to replenish also the collagen. Plus, may travel si Kyle eh. So, we don't want something na may long downtime. And, since magta-travel si Kyle, kailangan skin ready.
Yes.
And kailangan may mga antioxidants sa skin,
Yes.
pang-fight against, alam nyo na, environmental pollutants. Yan. Tapos, I don't know which area he is going or where is he going. I don't know if it's cold or warm or hot. Yan. So, something in his skin to kind of nourish and make it healthy looking and boosted. We'll show the treatment when we return. So we're back. We're with Kyle. So we will be doing the kind of like a maintenance treatment for the under eye concern. So right now I can see again a beginning hollowness of the under eye area. And because of that hollowness, it's creating that kind of like dark shadowing. So like when like light reflects on the skin, it creates that kind of like a dark reflection, okay? So we want to restore the volume here in the tear trap section. And I notice again, Kyle, some fine lines and smile.
Yes.
Ayan. So, we did an injection of botulinum toxin also a year ago, right? So, Kyle is still young. So, 24? 20?
Yes.
Yeah, turning 25. Yan. Aging daw starts at 25. So, it's already prevention, okay? So, when I do my under eye treatment with our injection, we will be using our Colshine. So, we can do a marking here. For example, if you have your marker, so make a vertical line from the lateral canthus here, a straight line, and then from your alar groove, a horizontal line. So the point where they meet is your entry point, and then you'll just deliver it towards the tear trough, and you can deliver it in the mid-pupillary line and also in the lateral canthal line. So you can use your fanning method. You have a cannula, so disinfect. So a while ago, actually, we cleansed the skin, we applied numbing cream, and then I have a so-called introducer needle here. So I got this from Korea. I can actually poke the skin right now like this, and then just leave it there and direct my cannula inside. So no need for me to kind of like be looking for the kind of punctured point there. So now I'll follow the line that I drew and then just direct it into the subdermal plane. So for your collagen, you want to place it actually dermis layer or even your subdermis layer, okay? Since this is already actual collagen, it's the atelocollagen or type 1 collagen. So the good thing with this material, it's a collagen that's homologous to our natural collagen in our skin. It's type 1 specific collagen present in our dermis. So this is a mature type of dermis collagen. So I'm just gliding and I'm just injecting. So you can inject tiny aliquot of your product. So the good thing with this one is after the procedure, you're fine. There's really no long downtime. Plus, we're using a cannula method. So we're avoiding the bruising from those multiple needle injections. Because in the past, we're using the so-called serial puncture technique whereby you have a lot of pokings or needle injections. So right now, we can just deliver the material using this our cannula. Okay, so I'll deliver it now into this side onto the lateral canthal area. So as to the amount of the product, you can use, for example, this 1 ml, half ml per side. Okay, so I'll just deliver towards this side. So we also want to correct lateral canthal lines, and then just deliver the material. Just deliver it here. So you can place this collagen in the deep dermis to the subdermis. So this is atelocollagen. And the good thing with the product is that they were able to remove the antigenicity via cleaving off those terminal peptides on the amino terminal end and carboxy terminal end. Ayan, napapa-biochemistry na tayo, Kyle. Because I teach molecular or like biochemistry and protein science, protein chemistry, protein metabolism is the one that I always lecture. So I'm placing again into the tear trough. So this one here. So this is collagen injectable. Now, depending on the degree of like collagen loss, some people will need more sessions for collagen replenishment. Like, of course, the older we get, the more collagen we lost. So some people will require more than one session. Okay, so since Kyle is young, so it's okay to have like at least a single session in a year. Yeah, because in a year, we're losing about 1 to 1.5% of this collagen material due to, yun nga, aging. Yan, it's like yung system, right, Kyle? It's really going towards that. Well, sad to say, the degeneration of our materials inside the body. Yun, that's a reality. It's a reality. Okay, so last one na lang here. And then, before I proceed to the left side, of the face, I'll be doing a second kind of like skin booster treatment, also using the product Colshine. Now that skin booster treatment, we had it diluted, and then we will be using our device here, a multi-needle injector. Okay, so on the tip, you already have like 9 pins, so multi-pins. And we will use this device to deliver our collagen material into the dermis layer. So I have the Pella Pro here. So I'll do the half side of the face. I'll be starting on the lower part. Okay, Kyle? This is something like a prick sensation. It's good? Okay. So we can also use the paint. There you go. Something to help the skin. So you can inject it into the dermis layer. So I mean the 2mm there. So it's a multi-suction injector device. So this will deliver our product into the skin dermis. Another method that we can do is just the so-called intradermal papule technique, a meso-injection technique. You can just do it manually. If you don't have this device, you can use the gauge 35 2mm needle to deliver this material. If you don't have the injector, for some of our providers who want to do this same kind of treatment, you can do this multi-needling, or you can also do the manual like 1-by-1 injection technique. We've already shown that in the past episodes, past videos, like an intradermal papule technique. Okay, you're okay, Kyle?
Yes po.
So again, I am delivering a collagen type 1. So we did also the under eye area. Actually, I've seen an instant result with the under eye area. Okay, so we'll be proceeding with the temple. And then later on, we'll also add some microtox to target the wrinkles on the corner of the eye and the under eye area. Yan. Para Kyle, when he travels, wrinkle-free face. Okay? So, he'll be away for about a month. Yan. So, skin ready, plus also this kind of skin booster treatment will help his skin. And at the same time, fighting aging. Yan. And maintaining that good quality skin. Actually, right now, Kyle, it's what people are looking for in clinics. How to improve their skin condition. Plus, people are looking for a treatment they call parang glass skin.
Yes po.
So, they want to rejuvenate the skin. And this is a very good treatment. So, let's proceed to the other side. So we've done our under-eye treatment together with our multi-injection procedure. We'll show the result when we return. And we're back, so let's show the result to Kyle. Kyle, mirror, just for you to see the multiple punctures on your face. And then also the under eye area. Actually, with the under eye, I've already seen a result. Yan. Although with the multi-injections with our skin booster, of course, you still have those tiny marks, tiny injection marks. We had just right now, we just did it, okay? But in a little while, it's gradually going away. Plus, we will still do the so-called Healite, which is a device for anti-redness, anti-inflammation, and plus it also improves further the quality of the skin. So again, our goal is for skin tightening, improving the skin quality, rejuvenate the skin, regenerate the skin, plus also make the skin pores tightly closed or minimize skin pores. At the same time, it has also some brightening effect or lightening effect. Because I noticed some areas some pigmentations. So Kyle has this uneven skin tone, but it's very minimal. Plus, Kyle had a management of like an anti-acne treatment in the past. Right now, he is on a so-called microdose of the oral isotretinoin. So he has to do some skincare treatments at the same time. Procedures like this to improve the skin quality. And of course, when you are taking oral isotretinoin, it controls the oiliness. So what's happening is kind of like the skin, you feel like it's dry. So you need something to hydrate the skin, restore that, the normal balance between oil and water. And at the same time, improve the quality. Plus, get rid of the pigmentations and make it even yung skin tone. Yan. Ano sa palagay mo, Kyle? Anong feedback? Anong experience?
May isang line po ako dyan eh. It looks better than how it feels.
Okay.
Kasi talagang feeling ko parang, wow, ang dami nangyari. Pero, okay. Kasi parang feeling ko bugbog sarado ako. Pero, in a way, nakikita ko na po siya. May instant effect din po. And I'm actually looking forward dun sa kapag nga po nag-tighten na, tsaka nag-recover. Yung ganun.
Yes,
very
a
much
very
satisfied.
improved skin. So this is Colshine treatment. So actually, we can have an effect of the so-called Colshine glow. Yan. We also want that. Mga kalalakihan, hindi nila nako-cover yung mga blemishes. Hindi naman sila syempre nagme-makeup. Unlike ng mga girls, di ba? We have something to cover, conceal, yung mga imperfections ng skin. But sa men, ito yung problema. So talagang kitang-kita kung open pores or large pores, kung may mga blemishes dyan, may mga pimples dyan, may zits, or any skin imperfection. So, especially for men, of course, it's not something like, lalaki ako, I don't need that, right? So, your skin's health also is important. Sabi nga nila, yun daw, skin natin, yun yung parang visual medical certificate. So, yan yung nakikita nila sa panlabas. Nakikita nila yung quality ng skin mo. So, meaning to say, you have a good health as well. So, skin health matters.
Yes,
So, for males who are looking for a treatment na non-invasive or non-surgical or walang mahabang downtime or you just want a good skin condition and restore yung health ng skin ninyo, this is a very good treatment. So, this is Colshine. Colshine treatment for under eye plus all over the face, pwede rin sa neck, so we can improve the skin condition and skin quality. We also added botulinum injection on the crowfeet area and a little bit some of the wrinkles in the infraorbital region to get rid of those lines and wrinkles. Thank you, Kyle.
Yes po, thank you, Doc. Thank you po.
Busy ka. May biyahe pa to. Yan, mag-i-impake pa. Yan, get ready. So, we'll still check on Kyle. He'll be sending pictures.
Yes.
He'll be sharing photos. So, we'll check on how this Colshine had this good effect or good result, good outcome for Kyle. Thank you, Kyle.
Thank you po, Doc.
Yan.
Thank you po.
Followers? Meron kang mga followers?
Wala po.
Followers. Okay. So you can follow us at our Instagram, CSA Medical Aesthetics, our FB page, CSA Medical Aesthetics. If you have questions, you may email us at csaskinclinic@yahoo.com, and our clinic is located here at the Infinity Shop, Pulong Maragul, Angeles City. Contact number 0933-860-9193 or 0917-504-4268. Please also watch the previous episode of Kyle, the under eye filler. It was Redensity 2.
Yes.
Okay, so thank you so much. God bless you all. When it comes to natural beauty, you can trust the CSA Medical Aesthetics.